A new study headed for publication in the Journal of Post-Acute and Long-Term Care Medical Associations, raising questions about how states license AL communities and what that means for older, low-income adults relying on Medicaid. Researchers say state licensing policies play a critical role in determining whether Medicaid can actually be used to pay for AL services. And that matters because older adults who receive home and community-based services in AL experience fewer adverse health events than those receiving the same services living independently. Recent federal legislation substantially reduces federal Medicaid funding, limiting the state's abilities to maintain Medicaid-covered AL programs and remain vulnerable to state and federal budget cuts. Analyzing 2019 data from nearly 33,000 licensed AL communities nationwide, 89% of communities had a license type allowing them to accept Medicaid. Yet only 44% were Medicaid certified, meaning most communities that could accept Medicaid simply didn't have a contract in place. And Alabama, Kentucky, Louisiana, Virginia, and West Virginia had no Medicaid reimbursed AL in 2019 at all. Researchers say the gap highlights the need for states to better align licensure rules with Medicaid payment policies, ensuring affordability, access for vulnerable adults, calling for research on why eligible AL providers choose not to accept Medicaid, and how this ultimately affects residents' access and health outcomes.